Hello, my name is Steve Baker. I'm a Rotarian from the Rotary Club of Key Biscayne in Florida in the US, and I welcome you to my talk about End Malaria Now in Colombia. Let me tell you that I've spent quite a long time in Rotary fighting malaria in Latin America. I've done 3 global grants in Venezuela and 1 in Peru. Together, we've delivered about 100,000 bed nets, treated bed nets to people in those countries, and significantly cut the transmission rate of malaria there due to these Rotary projects. And I'm going to talk to you now about a project that we're going to do in Colombia, another Latin American country. Our global grant, End Malaria Now, Colombia, will concentrate on eliminating malaria in a collection of smaller towns that are on the Pacific coast of Colombia, where there's quite a bit of malaria transmission. There's 5 or 6 towns in the area with some outlying villages with a total population of about 8,000 people. I say about because the population fluctuates quite a bit here. There's quite a bit of illegal mining going on around Zaragoza, and that brings people in and out for short periods of time while they're working in the mines. And really changes the population numbers in the area. But we know there's a stable population of about 8,000 and then some other people who are coming in and out. And we want to benefit all of these people by eliminating malaria in that area. I want to talk a moment about the disease itself. Malaria is a parasitic disease caused by the Plasmodium parasite. In human beings, there are 5 varieties of the Plasmodium parasite. In Latin America, primarily the 3 of them, Vivax, falciparum, and malariae, is what's seen. And this disease is transmitted to us from infected mosquitoes, infected Anopheles mosquitoes that bite at night. And this is the primary reason why bed nets are such a powerful tool against the disease of malaria and against the Anopheles mosquitoes that want to bite us. This disease, malaria, is a disease of both human beings, but also of mosquitoes. The parasite requires both of us to complete its very complex life cycle. And if you can eliminate all of the mosquitoes, the disease simply goes away because there's no more infection being transmitted to new patients. However, that is a very difficult task and one that is proven impossible in places like in Latin America where I've worked, where there's jungle and water and constant rain in the rainy season. It's really not a possibility, and bazillions of mosquitoes. So it's really not a possibility to eliminate them all. So we have to use other strategies to control and eliminate malaria. Now, malaria is a killer, as many of you know. It's killed approximately 18 million people since 2000. Most of those people have been in Africa, but not all of them. There are many deaths in India and Pakistan, in the Pacific Islands, and in Latin America as well, due to this terrible disease. So, as I'm saying, it is a disease of the tropics. And you see here, let me just grab a pointer. There we go. And you see here, this is Brazil, this is Venezuela, both hot spots of malaria. Of course, plenty of malaria in Africa, India, Pakistan, and the Pacific, but we're going to be talking today mostly about Latin America. And I do want to point out one thing here. This little country right here in the blue, that's Paraguay. And Paraguay was declared by the WHO as malaria-free just about 1.5 years ago. That means that they didn't have a single transmission of malaria in 3 years in that country. And they did it using very similar ways that we're going to use in Colombia. And they were able to completely eliminate malaria. And that is also true in El Salvador, which recently did the same thing. So we know it's possible. Now, malaria is a disease of poorer countries and poorer people. People in developed countries like in Europe and in North America, where there was once quite a bit of malaria, are protected by the shield of their very developed medical system. So in some place like America, somebody gets a fever, they immediately go to the doctor, get tested, get treated, and get cured. And in places where there really aren't enough physicians, there aren't enough places to go to get tested or diagnosed or medicated, this is where malaria spreads. And it is very difficult for families where parents are sick and can't work. Families get very, very hungry. It's a terrible disease from the economic point of view, as well as the physical health of the people who get it. Now, we're going to concentrate on one little area of, I should tell you that our project is a pilot project, and we'll come back to that in a moment. So we're starting small on this one. And this map shows you the area we're going to work in. This is the Pacific coast of Colombia. This black mark here is the city of Buenaventura, a port city. And out here, this little piece here, that is Anope Ocho, where we're going to work. It's a lovely area, hills, jungly, lots of water, lots of mosquitoes, and plenty of malaria endemic in this area as well. A couple of things to note about malaria in general. One of them is that you really need to eliminate the disease totally, or it will come right back. In other words, you have to get rid of the disease and all of the mosquitoes and all of the people simultaneously. And this chart is a good example of what happens if you don't. In 2013, they almost had the disease eliminated in Buenaventura, but then over a period of a year or so, resources, medications, testing kind of faltered, and within 2.5 years, malaria came roaring right back, and this is what it does. This is a disease where you have to get rid of all of it, eliminate it completely to keep it out. Another thing to know about this area, Anope Ocho, is that most of the people who live here are of African ancestry. They were brought over to Colombia in the 16th and 17th centuries to work on farms as enslaved people. They are no longer enslaved, obviously, for hundreds of years now in Colombia, but they brought with them many things like great food and wonderful music and athleticism, and also a genetic mutation similar to sickle cell disease that it gives them something called a Duffy negative phenotype. And what that refers to is a coating on their red blood cells that is different than the rest of us, and who don't have this phenotype. And that coating on their red blood cells prevents the Vivex form of Plasmodium from entering the red blood cells and giving people symptomatic malaria. What that means is that almost all of the malaria in this area is falciparum. And that is an opportunity and a risk. The risk part is that falciparum is the most dangerous of the 5 types of human malaria. It kills more people than all the rest of them put together. So it's a danger. However, the opportunity is we have great drugs for falciparum now, and when properly diagnosed and treated, it is completely curable. So we have the two. We have the danger and we have the opportunity in this area. So our objectives are to first stop transmission. That is absolutely key to elimination. You've got to stop malaria transmission. And after that, we will do many things to increase sustainability so we could totally eliminate it in Anope Ocho over the long term. And one of our other objectives, in fact, an important objective of this program, is to strengthen our connections with the local government officials and local health officials and local leaders, because we want to use what we learn in this pilot project to do a follow-on, much larger project to eliminate malaria in all of the country of Colombia, and we will need much better relationships with these folks than we have at the present moment. And our experience in doing global grants is they draw together the people, the Rotarians who are doing it, and the folks we are working with as partners to make a logistic success of the elimination program. We had our needs assessment for this global grant in April. The pictures you see here are of Rotarians. Here's our leader, Rodrigo Diaz, for this project. And they're talking to community leaders and medical staff, especially people like the microscopistas, people who operate the microscopes, and others in a variety of the towns in Anope Ocho. And we're setting up, we're finding out what they feel they need and what their problems are related to malaria and healthcare in general. But we're also, at the same time, building confidence with leaders in the community that will have to help us as we execute our program. So the way we're going to stop malaria is using a number of tools. And our best tool and our biggest tool is a container, a 20-foot container full of insecticide-treated bed nets that have been donated to us by the German chemical company BASF. Now, these are long-lasting insecticide-treated bed nets, really effective at killing mosquitoes that land on them. But we are also going to, during the distribution of the nets and during a follow-up that will occur about a month after the nets have been distributed, we'll be teaching people how to use them and how to care for them so that the nets will last as long as they're capable of lasting, which is about 3.5 years. And we know from experience in Latin America that when everybody in town uses their net all the time, we can get 70% or more reductions in transmissions. But that still leaves 30% to be dealt with. A very strong adjunct to bed nets is interior wall spraying. And our project will be purchasing pump sprayers and chemicals that we'll donate to the local healthcare unit out of Buenaventura. They have the trained sprayers and they have the ability to do this kind of interior house spraying. And this works because it sprays a chemical quite similar to the one that's used in bed nets onto the walls, which crystallizes and stays on the wall for 3-4 months. And the way it works is this. A mosquito bites us at night. It gets too heavy to fly very far because of the weight of the liquid that it takes up. Well, the mosquitoes only need the protein from the red blood cells. So what they do is they fly away from the person they've bitten, land on a wall, eliminate the weight of the liquid overnight, and then go on, during the daytime, I should say, and then go and bite somebody else the next night. If they land on a wall that's been treated, they die, and thereby breaking the chain of infection. So this is a really effective way to help us eliminate malaria. Another thing that we're going to do, and you see up here in the corner, these roundish places, this is a river, and beside it are ponds that have been dug by gold miners, many of it illegal, to pan for gold and to use other methodologies to get the gold out of the water and out of the sand. And once they're finished, they abandon these. They don't fill them in, they just leave them. And they are full of mosquito larvae. So one of the things we'll do is buy larvicides and apply them to all these abandoned ponds in and around Zaragoza, where the mining activity is worst. A really important part of eliminating malaria is immediate diagnosis and treatment. So we are going to support the microscopistas who do the diagnosis in all of these towns by making sure that every town has and every clinic has a working microscope. Our budget includes 2 microscopes for towns that don't currently have them, as well as purchasing of the disposables that they need to do the work. So we're going to make sure that they have enough stain, enough slides, enough slide covers, enough reagents to do the diagnosis. Another important factor is a lot of the microscopistas are getting older and starting to retire, and we need a new generation of younger microscopistas fully trained. So we have money in our budget to do exactly that. We'll work with the local hospital in Buenaventura to train up a whole new cadre of microscopistas to work in the area and thus sustain our effort. We'll work with the Red Cross to do monitoring and follow-up of all of this microscope and diagnosis work. The Red Cross is licensed by the government of Colombia to collect statistics, and we will work closely with them in this and other efforts in our project, which I'll talk about in a bit. Now, sustainability, yes, it's microscope repair. Yes, it's things that are needed for diagnosis, but most importantly, it's education. Education of adults and education of children about how malaria happens and how to prevent it. So we will have education, and they'll be different for both adults and children. Primarily, the adult education will occur during the distribution of the nets and with a second set round of visits after the nets have been delivered. And we'll be talking to adults about things like if you have a fever, go and get tested. If you test positive, demand drugs and take them. Take them all during the time of fighting the disease. We'll also talk about vector control, how to control mosquito breeding sites, and things of that nature. But it's the kids' education that's the real key. And we've learned this from work we've done in Venezuela and Peru, that if you educate the kids about what malaria is all about and how to prevent it, then they will really put pressure on their family to do those things. And you'll hear them say things like, Mom, why aren't we using our mosquito nets tonight? Or why haven't we got out in the backyard and cleaned up all those rubber tires or the mosquitoes are breeding? So we're going to put a lot of effort and a lot of money into the training of kids. And we'll be using things like theater and music and games and contests for the kids' education. And I have to tell you that a lot of the work that have been done by our African colleagues with children's education has been extremely helpful as we developed something for the Colombian children. We've also had help from cadres from both Paraguay and India in developing this program. So we're really looking forward to an excellent education program for kids. Of course, every Rotary Foundation global grant at the present moment needs to, if they're contacting people directly, they need to have biosecurity against COVID. So our budget includes money for masks and hand sanitizer and anything else we might need when we're in contact with public and when our partners like the Red Cross are working with us are in contact with the public during our work. We have important partners in this global grant in Colombia, including the National Health Ministry, but more importantly, the District Health Ministry out of Buenaventura. We'll be working closely with them. It'll be their staff that'll be using the pump sprayers to do interior wall spraying, for instance. They will also be involved in the training of microscopistas at the local Buenaventura hospital. We're working with the local and international, but most importantly, the local Red Cross in the area. We'll work closely with them during distribution and distribution of bed nets and also education of adults. We work with RAM Global, which I'll talk to you about in a moment, and we've had great help from the cadre, the Rotary Foundation cadre in designing our, especially not just the entire project, but more importantly, we've had tremendous help on designing the kids' education program that we're going to do. And one other group that I'd like to mention is PAHO, the Pan American Health Organization. This is a division of the World Health Organization, and they're involved strictly in Latin America. They provide things like vaccines in Latin America and other medical support for countries. And we're dealing directly with the director of PAHO in Colombia, who's given us a whole lot of help in project design. Our budget is $140,000, as you can see here, and we're very close. We're within probably a few days of completing our fundraising, and that means we can start our project on the ground really soon. And we're really, really very proud of our fundraising and our efforts to get this project going, and real pleased to be real close to it. So we really appreciate your support and your interest in Malaria Now, Colombia, and we will have opportunities for Rotarians who want to travel to Colombia and participate in the work we're doing on the ground. So stay tuned for that. I'll leave my email and WhatsApp information, contact information with your club president, so that you can contact me if you have any further interest. Another way you can find out about what Rotarians are doing around the world against malaria is RAM Global. RAM Global, Rotarians Against Malaria Global, is the Rotary Action Group involved with malaria. You can find us at ramglobal.org, as you can see on the screen here, and it will show you many of the things we're doing in Africa and in the Pacific and also in Latin America. So RAM Global has supported projects with money, actually, in Tanzania, in the Gambia, in Liberia, and we're also working to train up community healthcare workers. And you can find out about all these projects and everything else having to do with malaria and Rotary at this website. I highly advise you to visit it and check it out. And with that, I'm finished with my speaker engagement with your club. I wish I had the opportunity to answer questions, but this being a tape, that's not going to happen. However, if you want to submit questions to me, I will by all means answer them, and you can get my email address from your club president. Thank you for your attention, and goodbye.